Hi everybody, today's topic is periods. I get asked questions about this all the time, so there's a lot of information to cover. Hang on, and I'm going to try to quickly hit all the frequently asked questions, the main topics. First of all, let's start at the very beginning. Puberty for girls in America these days, it seems, is starting earlier and earlier with an average period start age of around 11, but it can vary widely. It does vary some depending on the mom's age when she started her periods. So for little girls, typically puberty, the signs of puberty starting will be a body odor and then breast buds. The buds will start as one side and then the other. So don't be alarmed if you have a tender nodule beneath the nipple that starts only on one side and then the other side will join in. And then the child can go on to develop some pubic hair, increasing breast tissue development, and then underarm hair. And then usually within a year or two, periods can start. So all the other prerequisites have to be in place generally before the cycle first starts. Now remember, for the first 1 to 2 years, the periods are often what we call anovulatory, meaning that the teenage daughter or the child is not actually ovulating, but they will still have menstrual bleeding about once a month. Now, for the first 1 to 2 years when they are anovulatory, the cycles are generally light. They can skip a month, and that's totally fine. They could skip several months and that would still be okay as long as they're not sexually active. A skipped period is not dangerous. I tease the girls that it's kind of a bonus if they skip a month, and it's not anything that we're really worried about. But then usually once ovulation kicks in, about 1 to 2 years after the very first period, then for a lot of girls, the cycles can become heavier, more flow, and can become more crampy, but also usually become more regular. So that's when we can start to see problems, and that's one of the things I want to address today is reasons we would become concerned. And so the definition for us of a bad period would be excessive cramping to the point of missing school, excessively heavy flow, or even just so unpredictable that it can often be a big pain or a nuisance for the teenage girl who just doesn't know when her next cycle is going to start because they're so irregular. So it's hard to say what heavy flow is because nobody knows how heavy somebody else's flow is. There's not a great unit of measure for this, so I usually go by imagine a soaked pad, a pretty large size pad soaked. How many of those would you guesstimate in a 24-hour period? And if the girl says greater than 10 soaked large pads, that's probably pretty heavy flow. And some girls who do have very heavy flow have to use tampons and pads, and in some really severe cases they'll say, oh yeah, I'm saturating a large tampon and a large pad within 1 or 2 hours, and that's obviously very heavy and excessive flow. Let me throw this in here too. A lot of moms are very nervous for their daughters to use tampons, or maybe the daughter is very nervous. It is perfectly acceptable. The only reason some people are very nervous about it is there is a rare but genuinely scary disease called toxic shock syndrome, which can result if a tampon is left in place longer than it should be. And basically it's if it's inserted and forgotten. So obviously they have strings on them. That's your reminder to remove it. It should not be painful as long as the flow is heavy enough for the tampon to become saturated. It should be able to be removed easily, but certainly it's not mandatory. A teenage girl does not have to use tampons if she doesn't want to, but if she does need to, such as if she's on the swim team or gymnastics or something like that, it's perfectly safe and acceptable to do if she needs to do that. So let me tell you what to do for the bad cramping. First of all, some gentle exercise can actually help. You can use any kind of medicine that blocks prostaglandins, because the prostaglandins released during the cycle make the uterus contract. They also, by the way, can make your intestines contract and can increase peristalsis, and hence a lot of times girls will have diarrhea around the same days as they're having some severe cramping with their period. So Aleve or ibuprofen are the best, and remember with both of those you should always have some food on your stomach so it doesn't upset your stomach further by taking it empty and irritating the lining. It's also, for severe cramping, helpful to use some warmth, like a heating pad, and then some pressure. So you could do a heating pad on their belly, and then you could do a pillow over that and just apply some gentle pressure, and sometimes that can help. Now, I wish I could tell you that for girls who have really bad cycles, the heavy flow, severe cramping, or just really unpredictable cycles, that there was an easy or a medium thing to do. But other than what we just talked about, there's really nothing to do other than birth control pills. So I want to answer a few commonly asked questions about birth control pills. We as pediatricians or primary care health providers do generally feel comfortable prescribing birth control pills, especially for straightforward, difficult periods. Now, they're also, it turns out, FDA approved for treating acne, and we'll sometimes get referrals from even dermatologists coming back to the primary care asking for birth control to help the teenage girl with severe acne, and we're happy to do that. Or for something called premenstrual dysphoric disorder, or PMDD. For some young ladies, that week before the flow actually starts is an extremely cranky, angry, irritable week, and all the family members are aware that it's the week before her cycle. It's that bad. She truly has a mood disorder that week before her period starts, and it's hormonally based because you can treat it with the use of oral contraceptives. Now remember, we often use oral contraceptives, or OCPs is what we call them, oral contraceptive pills, not even as a contraceptive, but just as a hormonal treatment for bad periods. So just because we're starting someone on birth control pills doesn't mean that we, her healthcare team, or you, the parents, are in any way telling her that it's okay to become sexually active. Now, obviously, we do also use OCPs to prevent pregnancy in teenage girls who are sexually active, but as pediatricians, we probably more often use them as controllers for bad periods. So the reasons to start them would be excessively heavy flow. If the flow is very heavy or the periods are very frequent, we may want to check a complete blood count to make sure her hemoglobin and hematocrit are okay, that she's not anemic. And we can do that with just a simple finger prick test in the office and run it right there in the office. We also have some mandatory screening. So before we would start birth control pills, we would want to make sure we had ruled out pregnancy, and we also have, because health insurance companies monitor our charts and can audit our charts, they have some mandatory suggestions that we screen for gonorrhea and chlamydia. Now these days that is so much easier to do than it used to be. It used to be a cervical swab obtained during a pelvic exam and a pap smear. Well, it turns out now we can just screen for gonorrhea and chlamydia, two of the most commonly sexually transmitted infections, with just an unwiped urine specimen in the office. And so we have to do that. Don't be alarmed if you see that on your daughter's explanation of her visit, because it is mandatory for us to do it. Even if they're not sexually active, it's what the insurance companies tell us we have to do. So we do that just to be on the safe side. Those are really the only labs we have to do, though, just the complete blood count if the flow is heavy, and then those screening tests for pregnancy and infections. Your daughter does not have to get a pap smear or a true pelvic exam unless there are additional concerns or problems, and most of the time, many pediatricians do not even do those, but would refer out to a GYN. So I have a lot of moms who ask if the child has to see a gynecologist to start pills. The answer is no. And do they have to see a gynecologist to start getting their pap smears when they're 16, 17, or 18? The answer now is no. The guidelines have changed, so that only has to start when they're age 21, which is nice so that they can still stay with us. Let me tell you a few myths surrounding birth control pills that can keep some girls from starting them when even they could really be helpful in their lives for all the symptoms they're facing. Some girls believe that if they start OCPs, they'll automatically gain weight, and that's not true. It's just like the rest of us. If you consume more calories than you burn, you will gain weight. If you burn more calories than you consume, you will lose weight. And so it's the same equation whether or not you're on birth control pills. Some girls believe that they'll have a bad reputation if they start birth control pills. Well, nobody's going to know what medicine they're on for bad periods unless they tell them. So if they choose to spread the word that are on birth control pills, that's kind of their call, and maybe they're doing that for unclear reasons, but obviously it's no one's business, and everything that happens in our office is confidential, and so there's no reason to think that would be true. And again, we try to warn the girls if we're starting birth control pills that this in no way protects them against sexually transmitted infections and is no way an endorsement for them to become sexually active. So a lot of those things are myths. The only contraindications really we have for not starting birth control pills is if we don't recommend it if patients are smokers, which we don't see a lot of. Of course, more adult providers would see that. OCPs are not recommended for ladies over age 35, but that's not in our population. And if the teen has a family history of a clotting disorder, we would investigate that a little bit more before starting the OCPs. But those are really the only things. Our biggest concern in starting OCPs in teenage girls is that they have to be taken every day to work properly. And so sometimes we will end up referring to a GYN because they have additional options for period control than we do. And birth control pills really don't work well if they're just taken hit and miss. They need to be taken around the same time each day, and they need to be taken regularly every single day. We do try to teach them if you miss one pill to go back and take up to 2 at one time, but never more than 2 at one time. And if that's happening often, that's probably not the best form of period control for them. I think we covered all the things we usually talk about with the young ladies. If you were in my office today and I was prescribing you or your teenage daughter birth control pill starting today, I would recommend that she wait until her next regularly occurring cycle, and then whichever the following Sunday is. So if she starts on Monday, that very next Sunday, or Tuesday, Wednesday, Thursday, Friday, or Saturday. Even if you started on Saturday, the very next day I want you to start the pack. Because if you start the pack on a Sunday, your periods are typically going to be from a Tuesday to a Friday, so you would have no weekend periods, which is pretty awesome. So there are a lot of benefits to birth control pills as far as the decreased flow, decreased cramping, decreased acne, perfect predictability, and then the potential treatment for the premenstrual dysphoric disorder as well. So they have a lot of very great side effects when we use them for period control. But for a lot of times, if the flow is not excessive and there are no big problems, just minor problems, we encourage them that this is pretty normal and periods are supposed to be a routine aggravation or nuisance, but they shouldn't be life-changing, or you should talk to your pediatrician. As always, consult with your child's own individual pediatrician about these specific questions. Thanks, and I hope you found this helpful.